to today's presenter, Ryan. Ryan, welcome.
Thank you, Owen. Appreciate the opportunity to do another webinar with CCSN. So here's the slide with my contact information. As Owen said, I'm happy to put that back up at the end of our session today for your further information. So here's an overview of what we're going to talk about today. We'll start off with sort of the two pillars of effective advocacy, one of which is telling your personal story, but I will talk about the other one in just a moment. We'll talk about developing and delivering your personal story. That's the bulk of what we'll go through today, and then incorporating your personal story into some of the advocacy tools that we use. And I've chosen 3 examples in particular that I think will be most likely to benefit you as listeners, and that you're most likely to use in a given circumstance, and then of course our Q&A. So there are 2 pillars of effective advocacy. They are, first of all, the ability to prepare and share your personal story, what we're going to talk about today, but also building and sustaining relationships with key decision makers. So I'm just going to take a couple of minutes and go through that latter one with you before moving on to personal stories. At the heart of effective advocacy, as it says on the slide, are good working relationships with key people in government or relevant institutions, depending on to whom you are advocating. And one thing that is important to remember is that it often takes time, in fact, it almost always takes time, to realize tangible results through advocacy. And that's because relationships are so important to the process, and it takes time to build good, solid relationships with people of influence. But one of the things that we always tell people is that if you cast the net widely enough, someone will know someone who knows the decision maker you need to get to, particularly when you're advocating to people in government. This is a small country in terms of the concentration of power at all levels of government. And so you're really not that far away from the decision makers in any given circumstance. And certainly if you live within one of the smaller provinces by way of population, particularly Atlantic Canada, it's often not 2 degrees of separation. You may directly know decision makers, and building and having relationships with those people is critically important. But it takes patience, being at the right tables or with the right people, staying engaged, and more than anything, not getting discouraged and giving up. This next slide, I won't read to you. I'll leave it there for your reference. But one of the things we're often asked is, but when I'm first starting out in advocacy and I don't have any relationships, what do I do? And these are some practical ideas that you may want to consider. It's never too early to start building relationships with decision makers, and ideally you want to do so before you need their help. And it's all about making that first connection. And every connection can be what is essentially a stepping stone to the ultimate relationship with a decision maker, meaning the person you need to get to in the context of your advocacy. But we tell people, don't miss a chance to communicate, and don't stop communicating. You just need to keep going in the context of building those relationships. So let me move on from that to, again, what the focus is of our discussion today, and that is your personal story in the context of advocacy. So let's start at the beginning. What is a personal story? Well, as it says on the slide, it's a summary in whole or in part, and I'll talk about the difference between those 2 things as we go through this, of what has happened to you as it relates to the issue at hand. So it needs to be your story as it relates to whatever that you're there to talk about, which again, I'll emphasize as we go along. It's also your perspective on the issue, as it says, based on your experience, feelings, and attitudes. In a face-to-face meeting or in written communication with a decision maker, your personal story makes your issue come to life. It makes your issue real for the decision maker. And let's use government as the example so that everybody sort of understands what we're talking about. A decision maker could be your MLA, your MPP, your MP, for example, if it's federal. It could be the premier of a province. It could be the minister of health. Or on the flip side, it could be a bureaucrat. It could be somebody that works within a ministry kind of thing, a deputy minister, an assistant deputy minister. Anybody who has decision-making power within the context of these things we call governments is a decision maker. But it's meant to be a person. It's meant to be an actual individual. If properly developed and delivered, your personal story should fuel the logic of your one ask. People who've been on previous webinars will recall me talking about your one ask. And we're going to actually talk a little bit about it today, too, in the context of your personal story. And it should also be emotional. But emotional in the context of healthcare doesn't equal sad. And I think a lot of people think that there's a correlation between an emotional story is a sad story. That's not what we mean. An emotional story is a story that is filled with emotions, highs and lows, hope and sadness. It's everything. It's just the existence as a human being and all the various emotions that one feels at given times in their life as they're going through these kinds of issues. And it will help to motivate and guide the decision maker to what you need them to do for you. So what we're going to spend the bulk of the presentation doing is going through the elements of a guide that we have developed through Advocacy Solutions called Telling Your Personal Story, a How-To Guide. It's just been updated very recently. The updated version is not yet available on our website. However, CCSN will be sharing a copy of this for all of you to review. It is obviously free, and it is really meant to act as a guide to do all of the things that we're going to talk about today. So that's really the overview we're going to focus on. And as I said, it'll be included for your use at the conclusion of the webinar. So we always start with what I call essential elements. There are 4 basic elements that should be included in the content of all personal stories, and I'll go through them now in a little bit more detail. So we always start with, or I suggest that people always start with, the basic personal details. And actually, let me pause there just for a second. I'm also a very strong proponent in a personal story following a chronological sequence. I trust that that's logical to all of you. I have heard and I've had the opportunity to review and edit personal stories that are not chronological. They jump around. I think that's fine in the context of a movie or a television show or something like that. But when you have 3 minutes and you're sitting down in front of a decision maker and you're trying to engage them in what your experience has been, there is no simpler format than to simply go chronologically from a time in the past up to the present sort of thing. So again, that may seem obvious to you, but I want to be clear about that. So keeping that in mind, the objective of this first section is to establish a basic picture of who you are and to really convey to the decision maker this, what I'll call, construct that I'm like you. I go to work, I have a family, I'm raising kids, whatever it may be. And so here are some examples of some basic personal details that you may want to start with. And these are just suggestions, but I think they're just a logical place to kind of start. The last bullet on that slide, using the word I and my, this is really, really important. Again, might seem obvious to you, but I have read personal stories where the person telling the personal story doesn't use the words I or me or my. They use words that talk about, for example, their family and how their family has dealt with a situation and what their family's reaction was. And that's fine, but they're presenting the personal story as an observer, not as a participant. Your personal story, you have to participate in your personal story. You have to talk about yourself. And that's not easy for some people. I understand that. But you have to talk about yourself. You can talk about your family as well, but don't forget to talk about yourself. That's the foundational piece of any personal story. It must be the foundational piece of any personal story. Some facts about your personal situation. This is the point that you transition from having set the stage to the circumstances that have brought you to today. And in many cases, when we're talking about healthcare, the circumstances, the turning point is often when somebody has been diagnosed, for example, or when they start to develop an issue with their health. These are typical turning points. In other words, I was going along with my life and then something happened. And that represents the turning point that is serving to bring the listener into why we're here today, what it is that we're going to talk about. This is also the first opportunity in most personal stories to start to open up about your feelings, how you felt. How did you feel when you were diagnosed? Or if you're a caregiver, how did you feel when your loved one told you they were diagnosed? Or maybe you were present when you heard the diagnosis. And this is all very critical, sharing your feelings, being emotional, sharing emotion, is critical if you're going to connect with the decision maker. It's absolutely an essential part of any personal story. Next, you need to transition from the fact of your, for example, circumstance, diagnosis, that moment in which your life changed, to the issue at hand. In other words, if you had a healthcare, let's take something in contrast. If you had a health issue, you entered into the healthcare system and you had it resolved, and throughout that journey, whether it was a day or years, everything went perfectly well. And everybody you've ever known or met who you shared, say, a disease with, it all went perfectly well for everybody, then presumably you wouldn't need to do advocacy, because nothing would need to change. Everything would be absolutely fine. So this is where you need to talk about the challenges that you've had as it relates to the issue at hand. And here's what I mean by that. If the issue that you're there to talk about is access to medications, then don't focus on the prolonged time to diagnosis. The prolonged time to diagnosis may be a critical part of your personal story, and that's fine. You can mention it. But if you've got 3 minutes, you can't spend 2 minutes talking about how it was very difficult to get a diagnosis in your circumstances when you're there to talk about the fact that you and other patients can't get access to medications, sort of thing. Your personal story has to focus primarily on the issue at hand. So again, you can mention all of the challenges that you may have faced, but you need to focus on the one that is linked to the issue that you're there to resolve. And finally, your action step, which is your one ask, what you need the decision maker to do for you as a result of what you've just shared with them. And as some of you may have heard me say before on previous webinars, you always make sure to ask for the one thing you need and not a list of what you want. You ask for the one thing you need from that person that you're in front of and not a list of everything you've ever wanted, for example, from government. Especially when you're advocating to government, if you ask for everything, you'll get absolutely nothing. So you need to stay focused on the one thing you need, even though you may need more than one thing. You may need several things, but at that given moment, in that circumstance, in front of that person, we always counsel that you only ask for one thing at a time. So this is a case where less is definitely more. And finally, just on this action slide or your ask must be tangible. It must be a thing. So it's not something like, I need your support, I need your help, I need your commitment. Those words don't mean anything in the context of advocacy. They are the words that politicians in particular make a living using, but they have no value in the context of advocacy because they're not tangible. They don't mean anything. So an ask to an MLA, for example, would be, would you write a letter on my behalf to the Minister of Health saying, the following 3 things, whatever they may be? That's an ask because a letter is a tangible thing. You can see it, you can feel it. it's real. So always make sure that your action, your ask, is tangible. So let's shift gears now to get into really the heart of all of this, which is developing your personal story. So getting started. Some general tips right off the bat. Don't aim for a polished story right away. These getting started strategies are about letting your mind essentially wander through possible versions of your story. That means you don't even need to start at the beginning. Remember, I said you need to end up telling a chronological version, or at least that's my recommendation. But you don't need to start writing chronologically. You can start anywhere. Don't worry about correct spelling or punctuation or grammar at this stage. It's good to keep in mind that you'll be sharing your story with the decision maker eventually. But when you're starting, write for yourself. Write as if it's just for you. Write to learn what you're thinking and what you deem most important about your story. So those sub-bullets that you see there on this slide, those are the ones we're going to go through now. And we'll start with free writing. Free writing, as it says, is writing to discover what you're thinking, what you have to say, and in this case, what you want to tell others about your issue. When you read it with fresh eyes, here are some of the things that you should look for. Look for ideas or sentiments that you've repeated. It's likely that those things are what's most important to you, and in turn, what might be most important to others. So if it's repeated, you're just naturally writing out here, free writing. If you seem to be saying something over and over and over again, that's a pretty big hint that that's important. Descriptions, ideas, feelings that surprise you. Are you surprised because something you've written is a powerful idea or description? If so, you'll know that's something you'll want to incorporate into your story. People don't always see that, though. My experience tells me that when I've read personal stories that people have prepared, I'll read 3 or 4 or 5 paragraphs about a lot of detail about a particular moment in time. And when I step back and look at the whole thing, that may have been very important to that person, the person who wrote it. There's no argument about that. But in the context of what we're doing here, it's actually largely irrelevant. On the other hand, I'll read a sentence or even part of a sentence that just casually or briefly mentions something. And when I read it, it's the crux and the heart of what we need to be bringing out in your personal story. But when you've written it, it's just kind of almost a throwaway. Oh, and by the way, this happened, or oh, by the way, I felt this way. And for the purposes of this exercise, that's the piece we need to elaborate on, sort of thing. And then finally, just on free writing, connections between ideas, events, and experiences you may not have thought about before. Are there connections, and are these connections helpful for thinking about how to potentially organize your story? Listing, this is another technique in terms of how to get going. And it says, and I'll let you sort of read on the slide some of the details around listing. Are there examples of things that you might list to get started? The big surprises, pleasant or unpleasant, of your experience living with your condition or that of a loved one, for example. What people most often say to you when you tell them about your diagnosis or condition. Put that down. How your closest friends and family have been affected by your condition. This is obviously very important. And just list it down, as it says. The most helpful things people have done so far in response to your diagnosis or condition, and the most helpful thing people could do in response to your diagnosis or condition. And then finally, the impacts on your life of government inaction or action or policy related to your condition. So if you're aware that the government has done something that affects you in a good way or a bad way or whatever it may be, understanding or listing that down might be a good way as well to get going. Using photographs can be a very, very effective tool. And if you do want to do this, then what we sort of recommend is an exercise where you have a series of photographs in front of you and you explain why each photograph is significant. What is happening to you at the time the photo was taken? How did you feel? A lot of people can look at a photograph and it takes them back to the circumstance, to the way they feel, to what was happening. And that can be very powerful in the context of building a personal story. Are there others in the photos? How did they feel at the time, or do you know? Are there connections between photographs? And what do the photographs represent to you? What do they say about your diagnosis, the challenges you face, the changes that have occurred or might occur in your life? And write as much as you can or as little as you like about each photograph. So like free writing, don't worry about grammar, spelling, or punctuation. Just view it and then write down what you're thinking as a result of what you're seeing. Again, the idea here is just to get your ideas really flowing using photographs. And then finally, asking questions and answering them, another technique. So you're probably familiar with the journalist's fundamental questions of who, what, where, why, when, and how. So just like a journalist asks questions that are appropriate to their task to report what happened, who made it happen, how did it happen, you too can formulate questions that will help to get to your story. It's a technique to pull out or draw out the elements of your story. Of course, you may also need to answer the questions you pose, so think of it almost as interviewing yourself for a story. This may not work for some people. I totally understand that. That's why we have different processes. But if you think like this, it can be a really effective way to, as it says, almost interview yourself to extract the elements of your personal story. Writer's block, or the dreaded writer's block. What do you do? Well, just a couple of things to consider here. Take a break. Sometimes a break helps. Try a get started strategy that you haven't used. So one of the ones perhaps you've been trying and it hasn't worked, you could try one of the other ones and talk it out. A lot of times people can verbally communicate just off the top of their head really, really effectively, but they struggle with writing exactly the same thing, and vice versa. So if you're the kind of person who is gifted enough, I consider it to be a gift, who can sit down and just in a coherent, logical way start to just tell a story or start to recount an event or something like that, then maybe that's your technique. Maybe you explain it to a friend. Maybe you record it and listen back to it. You are able to express something in a way verbally that you could never necessarily do as easily in writing. So you take the verbal piece and you transpose it into the written word. That's another thing you can do as well. Okay, rehearsal and reading. So a couple of ideas here, but we're going to review each one of them in a little bit more detail to really help you once you've formulated your personal story. Reading your story out loud. So the best way to prepare to tell your personal story to a decision maker, as it says in the first bullet, is to read it out loud, alone or to a friend or whoever it may be. As you're reading, though, watch for spots in your story where you tend to ad lib. That is, where you improvise and add material that isn't written in your story. Just watch for that. It might be fine. It might be appropriate. Maybe you're comfortable ad-libbing. I would never tell anybody don't do it. But if there are some really key points, some really salient points, I would at least take a moment to write them down in bullet form so that you have them in writing. Because when you're in front of a decision maker, you may be a lot less comfortable, you may be more nervous, and you wouldn't want to rely on your ability to ad lib and then it doesn't come to you when you're in the actual meeting and you've missed some of those really important points you want to make. But resist the urge to improvise, at least on a large scale, and add to your written story. So, and then part of this has to do with timing as well. So if you've got a limited amount of time, you've taken the time to write out your personal story, you can't just improvise, because if you've got 3 minutes and your improv takes you to 10 minutes, that's going to be a real problem. So I really do recommend, particularly people who are doing this for the first time or who haven't done this a lot, to stay focused on telling your story as you've prepared it. When you get really good at this, then you don't have to stick with this rule as much, but at first, it's really the best way to ensure you're going to do the most effective job. Timing yourself. When you've rehearsed your story, time yourself, and it says stick to 5 minutes at the most. In most cases, you're going to have no more than 5 minutes. You'll often have a lot less time than that depending on the circumstances. Obviously, don't rush through it. And if you're way over time, you're going to have to cut back. And if you're significantly under, you'll obviously need to make some additions. Now, again, if you're under 5 minutes and you have 5 minutes, as we'll talk about in a moment, with some circumstances, you may only have 1 minute, in which case, then you're going to have to come up with a 1 minute version of your story. But just, either take away what you need to bring it down or add. And 99% of the time, it's taking stuff away. I have not had a lot of personal stories where people just didn't say enough under the circumstances. There's no need to memorize your personal story. I know some people like to, I know some people want to, and if you are gifted and you can, by all means, memorize it. But you don't need to. Your delivery doesn't need to be perfect. This is not a test. Nobody is judging you. So if you feel comfortable walking in to a meeting and saying, I'm going to read this personal story to you, then that's fine. There's nothing wrong with that. As it says, it signals to the decision maker that you've put in the time and the effort and careful thought into doing it. I've met people who would never think, though, of reading their personal story. They actually think it's much more impactful if you don't. I think it can be impactful both ways. And I think unless you're very good at this, there's an inherent risk that if you don't write something down, then one of the critical points that you've spent the time developing may get lost. And that's really the main reason why we talk about the need to read your personal story in most circumstances. Stay focused. As you prepare to present your story, you need to stay focused on telling your story and sticking to the script so that when you're actually face-to-face, that's what you do. You may be interrupted as well. So having something prepared in writing will allow you to be interrupted, to go off on a tangent potentially for a moment, and then come back and know where you're coming back to. And the third bullet is really a technique to bring you back if you are interrupted by a decision maker, which sometimes happens, and not maliciously, but it can. So it's your ability to come back. And rehearsal as well, as it says there, specifically in the context of being interrupted, is usually a good way to prepare. To help you stay focused, we've come up with something we call the 5-minute story challenge, which is what I want to sort of take you to next. It's simply a series of questions that are all listed there that helps you figure out how to create a 5-minute story. So, is everything necessary? Have I got repetition in there? Is it focused on the issues? Are there any extraneous details that don't need to be there? Are there details that don't lead you to the ask? What about descriptions, sentiments, or ideas? Are they really supporting what it is that you're there to do in your one ask? And is there anything that's kind of least relevant, least interesting that you can potentially cut out in order to bring it down to 5 minutes? Now, again, if you've got 5 minutes and you read it and it comes to 5 minutes, then you don't have to go through this exercise. That's not our experience. Our experience is most cases people have 2 to 3 minutes and they've got about 7 or 8 minutes worth of content, honestly. It usually runs about 5 minutes over time. So this little, we call it 5-minute story challenge. It could be 2 minutes, it could be 3 minutes, it can be whatever it is that you need. This is a little exercise to help you bring it down to where it needs to be. In addition to that, the document that that you'll receive has a checklist which takes you through all of the content that we just talked about. So you'll have something on a page that you can go through to make sure that you've taken all of the steps necessary to develop your personal story. So in all that we've just discussed, it's really designed to get you to, again, essentially like a 5-minute version of your personal story. But you won't always have 5 minutes, as I said. So we always recommend that you have the ability to prepare the following. 2 things. 1, prepare a 1 and a 2-minute version, both of them, focused only on your portion of the story linked to the issue at hand. So if you go to the slide, you'll see whenever you're developing a personal story, you may or may not have thought about it this way. You really have 2 choices. You can either tell a summary of your entire story as it pertains to the issue at hand, 2 to 5 minutes. 2 minutes is difficult. That's really tough to do. It's possible, but it's really tough. So it's basically, here's my life in 2 minutes, or 3 minutes, or 5 minutes, or whatever it is. Or you say, I'm not going to tell you everything. I'm going to give you really just a quick overview, 30 seconds. And I'm going to focus in or hone in on that portion of my story that is related to the issue at hand. And that's usually a 1 or 2 minute version. So if you need to tell a 1 minute or a 2 minute version of your story, and we recommend you prepare these, it should be focused only on that portion of your story linked to the issue at hand. But we also recommend, in addition, for example, to a 5-minute version that we've been talking about, if you can, do a 2-minute version that is the summary of your entire story. That's the one I just said is really tough to do. Again, it's linked to the issue at hand, but it's an overall summary. That will be the most difficult one you ever have to do. But if you had all of these little versions, then you'd be set. You'd be set for literally any circumstance that might come up. The 2-minute version of your entire story is the one where you don't have a lot of time. It's almost like the elevator speech. It's a little longer, but it's, here's me in a moment. All of me in 2 minutes. That's a great version to have. And then you can bring that up to 5 if you've got more time. But then if you create some of these 1 or 2 minute versions related to the issue at hand, then that really focuses the decision maker, the person you're delivering it to, right into the essence of what you want to talk about in that 1 minute or what you want to get to in those 2 minutes. And that, again, can be really powerful as a form of communication and, again, focus. So let me conclude our session with where and how you would use your personal story in 3 specific advocacy tools, or with 3 specific advocacy tools. So, in a meeting with a politician. In any meeting with a politician, one of the attendees must share their personal story. This is in the context of healthcare particularly, but if you've got a meeting with 2 or 3 people, you're meeting with a politician, somebody's got to deliver their personal story. So if it's a 30-minute meeting, you deliver a full 5-minute version. That's fine. That's completely reasonable. 1 5-minute version, not 2 or 3 people doing each a 5-minute version. Deliver it either right at the beginning of the meeting, so prior to your 3 key messages and your 1 ask being delivered, or at the end of the presentation time. Remember, every meeting is divided up into, if you have a meeting with a decision maker, presentation, or sort of what you want to say, and then discussion, interaction, so that you can glean what the person's reaction is based on what you've told them. So you can do it at the end of the presentation time. Even if you're reading the personal story, make sure that you look up at the decision maker periodically, particularly at critical junctures. When you communicate a piece of information that is significant, that is important, or quite frankly, that is dramatic, pause, look up, see what the reaction is. And by the way, if you're with other people, they can be looking while you're reading too, but somebody needs to try to glean or gauge, did this person have any reaction to this significant piece of information that you just conveyed to them or not? Speak clearly, slowly, and deliberatively. And when you make a point of special note that is of special note, tell them. Say to them, the next thing I'm going to say to you is actually particularly important in the context of what we're here to talk about today. And then say it. It's a technique that's used by many people who communicate for a living to draw the attention of the decision maker at that moment in time. It's not to say everything else I just talked about was irrelevant, but right now, if you haven't listened to anything else I've said, right now, if you wouldn't mind, I'm about to tell you that I'm about to say something really important. And then it's a cue for that person, hopefully, to take particular note of what you're about to say. In a letter is typically a 1-minute version of your personal story. And the reason that most letters should focus on is that they're focused on asking for a meeting so that you can deliver the fuller version of your personal story. So the letter is an enticement through a 1-minute version to get a meeting to then share the bigger one, which is the 5-minute version, which tends to be more impactful sort of thing. So if it's a 1-minute version, it needs to be very succinct and laser focused, as it says, on the issue at hand. And of course, as I've said several times, this is typically the most challenging one that you can do. And then finally, to your network, to people that you know. It's not often considered an advocacy tool per se, but delivering your personal story in an effort to prompt people that you know to join your advocacy efforts can be a very effective tool. This is typically a 2-minute version that needs to be focused and compelling, particularly compelling, and should act, as it says, as a call to action to those that receive it. So I'm telling you my story because I'm asking you to join me in the advocacy work that we're doing, or I'm asking you to send a letter, or I'm asking you to sign this petition, or I'm asking you to do something. It doesn't have to be something big. It can be something quite modest, but you're using your personal story to draw people in, we're calling it your network, in order to have them do something. It can be delivered in writing or orally, either one. And it has to point to a tangible action, as I said a moment ago. So as a result of having heard your personal story, I feel compelled now to do X. And of course, X always needs to be tangible. It's your ask, so it has to be a thing. E-advocacy is given as an example there that we often use. Interestingly enough, this is also the same version that we often use with media. Same kind of 2-minute version of your personal story that will be used to communicate if you've ever done anything as it relates to interacting with the media. So that's it from me. I appreciate you taking the time to join us and to listen. And Owen, I'm happy to take questions. Thanks, everybody.
Thanks, Ryan. That was definitely a very insightful and informative presentation, so thank you so much. We can now jump into the question and answer session of today's webinar. We do have a few questions that have been submitted, but if you do want to ask Ryan any of your questions, the time is now to submit any other questions that you'd like to have answered. So Ryan, let me pull up the first question. Can you share any tips on shaping and identifying the most important question to ask with the aim of getting what you're asking for?
So we do a whole exercise around how to identify what your ask is in the context of our work. Again, some of you on previous webinars may have heard us do that, but essentially, it's an exercise where you sit down and you identify, okay, here are our issues. This is what's important to us. These are the issues that can be resolved through advocacy, and there's other pieces that you can look at Sometimes it might not be the most important issue to you as an organization or an individual, but maybe it's the one that's easiest to solve, for example. And then based on this sort of exercise where you kind of hone in on a particular issue, then what you do is you say, okay, so this is the issue. You figure out how it can be resolved and who can resolve it. And then after the messaging is developed, so what you want to say about the issue to the identified decision maker, that will formulate your ask. So it could be anything. It could be to write a letter. That's something tangible. It could be to amend a piece of legislation or a regulation or something that's tangible, because you can say, I want the words changed from here to here. It could be something to do with numbers. It could be something along the lines of, we need this amount of increased in funding from, X amount up to a certain amount more, or a percentage or whatever it may be. But it all involves something called due diligence. And what we mean by that is your ask needs to be able to stand up to a measure of scrutiny. So for example, if your ask is that you need funding, let's say, and then the funding increase needs to be 3%. Well, if you come to me in government and you say, we need a 3% increase in funding, one of the first questions you're going to hear, or certainly is going to run through my head, is why 3%? Why not 2.9? Why not 3.1? Why not 1%? Why not 10%? You need to have an answer for why your ask, whatever your ask is reasonable. So let me give an example that's pretty easy to understand. Members of Parliament are elected to represent their constituents to the government. That's the foundation of our parliamentary democracy. They have an obligation, some of them may not completely understand this, but they have an obligation to represent to the government any issues that a constituent may have as it relates to the jurisdiction of that level of government, federal or provincial, for example. So if you have an issue with respect to the delivery of healthcare, that is provincial, largely provincial. So you go to your provincial representative and you say, I have a concern about this issue. I want you to write a letter to the Minister of Health telling her that I or we have this particular concern. Your MPP or MLA is not obligated to agree with you. In fact, they might completely disagree with what you want them to say, but they have an obligation to make your voice heard. They have an obligation to represent you even when they don't agree with you. And so they have an obligation. It doesn't mean they're going to do it, but they do have an obligation to write a letter, for example. It's a very reasonable request. I can count on one hand the number of times we've had representatives refuse to write letters voicing a constituent's concern in 17 years of doing this. They understand this is part of their job. Now, it doesn't mean at the bottom of the letter they're going to say, oh, and by the way, I agree with my constituent's perspective. That's different. But they do have an obligation to do this. So the reason why I'm giving you this example is because your ask, whatever it is, must be set up for a yes. It has to be set up so that the probability or the likelihood is that they're going to do it. Now, if it's a big ask, it might take years for them to do it. There might be a series of sub-asks that go along with that. But it needs to be reasonable. It needs to have stood up to some scrutiny, so due diligence. It needs to be defendable. It doesn't need to be irrefutable. I can disagree with your ask, but it needs to have a measure of logic to it. And the example of writing letters is one that has a tremendous level of logic to it because it's their job. You can't get much more logical than that. But it doesn't mean that sometimes they don't display irrational behavior, even to a very logical ask. So I know this has been a very long answer, but the whole area of how to craft your ask, how to get there, how to frame it it's a big part of what we spend time doing with folks.
We do have a couple of more questions. Next question is it recommended to have different stories written to leave with the person or people we have met with? And if so, should it be actually written out or put in bullet points?
Yeah, that's a good question. I don't know that I've ever done anything like that before when we've had the chance to present orally, just because it tends to be more impactful. I have no issue with somebody who wanted to leave a written version of their personal story. I think one of the challenges is, are they going to read it? If you think they're going to read it, then I think it's reasonable to leave it with them, depending on the connection that you've made with somebody. I would put it in the form of a personal story, though. I'm a big fan of structure, chronological flow, paragraphs, sentences, paragraphs, all of that kind of proper grammar, all of that kind of stuff. I think a bullet pointed personal story to me doesn't demonstrate the same level of engagement or effort and commitment. That's just my own personal feeling. So I don't think there's any harm in doing it, but I would still put in the effort to write it out as a proper personal story.
We just got a comment submitted, actually, and it says, well done and well focused. Thank you, Ryan.
You're welcome. I've just put up my contact information, as I mentioned we would do at the end of it. Sorry, it took me a moment to get there, but hopefully everybody can see it. So,
we have another question that's been asked. Are there any online tools that you found to be useful for the cancer community to use in their advocacy efforts?
Not in particular. It doesn't mean they don't exist. Most of the tools that we use, quite frankly, we have developed ourselves out of necessity because there hasn't been a lot. This is the only comprehensive tool that we've made available in the past. We have other things coming. Nothing specific to the cancer community, because we do work in oncology and non-oncology, but I would bet that there probably are specifically for cancer patients. I have no doubt that there are probably some really great advocacy tools or guides that may exist out there, but I apologize, I don't have any that sort of readily come to mind or that I could point you towards. I wish I did, but hopefully there should be some out there.
And how many individual stories should you share in an advocacy campaign? Is there a such thing as sharing too many or too few stories?
Yeah, that's a great question. So let's distinguish between sort of a moment and a campaign. So in a meeting, say it's a meeting, I usually like to share no more than a couple, just because it's usually not practical to share any more than that. So a really impactful or one formula that we'll sometimes use is a patient and or a caregiver. So that's that could be two personal stories from the perspective of a patient, perspective of a caregiver or survivor, for example, delivers their personal story. A clinician can also deliver. We don't call clinicians personal stories. We call them shared experiences. So it's a tell us about your personal experience as a clinician treating patients, for example, in this particular area or a particular area. And so they share a version of their experience as treaters. And so it tends to be an amalgam of, this is what I've seen as a clinician who treats, lung cancer or whatever it may be. And sometimes they'll use examples of patients that they've had in the past, anonymized, of course, or just a general amalgam of that. That can be really powerful in a given meeting or a given circumstance to use. In a broader campaign, there is no such thing as too many personal stories. You can have as many as you want. Now, how you use them, how you frame them, that is a little bit different. But let me say one thing about that. We often talk about finding what I'll call the perfect personal story or the perfect circumstance for a given campaign. And that, again, it's a perfect situation for the purposes of this campaign, and it's not the best language I suppose to use, but it is what we will often say in this context is someone who in a given circumstance at that moment in time is in need of the thing that everybody is asking for. So a medication is a very simple example. A medication is available, but it's not publicly funded. So it's available, but it's not accessible. A patient needs that drug based on their clinician's recommendation at that moment in time. Their personal story can be extremely impactful to basically be able to go in to a government official and say, my clinician has recommended that I may benefit or could benefit from this drug. Your government's not paying for it. I'm here sitting in front of you today on behalf of myself and others who could benefit from access to this medication to ask that it be publicly funded. Let's say if you're sitting in front of the health minister or, you know, a drug plan manager, whoever it is. That is a story that is worth everything, because it's no longer just, you know, my circumstances are such that it's this, but it doesn't quite connect up with the issue. It's not exactly this. It's not me, it's others, that kind of thing. So in the context of a campaign, when you have all the personal stories that you can gather, and you can find any that link directly to the moment in time, the thing that you're asking for right then and there, that is a personal story that we always put front and center and lead with, and then we surround it with all of the other personal stories to support it.
And one more question just came in. I missed the first 20 minutes, sadly. Will I be able to access the slides afterwards?
Yeah, absolutely. Yeah. Oh, and it's going to be available right on the CCSN website. So, yep, for sure. Yep.
Well, I think, Ryan, those are all the questions that have been submitted so far. If anything else comes in, I'll definitely make sure to forward them over to you. Or if anyone does have further questions that they can think of after this webinar, please feel free to reach out and send an email to partnerships, that's with an S, at survivornet.ca. And thanks to everyone who submitted a question. So that brings us to an end of today's session. I want to take this moment to thank every single one of you who have joined us for today's webinar. We also want to take this opportunity to thank Ryan Clarke again, founder and president of Advocacy Solutions, for joining us and presenting today. Just a reminder that this webinar will be available in full on CCSN's YouTube and SlideShare accounts tomorrow. And additionally, registrants of today's webinar will receive an email containing the links to today's webinar, and also the telling your story guide that Ryan spoke of earlier during his presentation today. So also please feel free to share today's webinar and the telling your story guide with your friends, family members, and colleagues.